Thank you for attending our webinar today, Making the Most of the Post-Go Live Assessment. If you have any questions, please submit them to the BC Solutions email or on the BC Solutions website, and we'll provide answers and provide them to all participants after the presentation. I would now like to introduce our presenter, Ms. Suzanne Butch. Ms. Butch was the Administrative Manager of the Blood Bank and Transfusion Services of the University of Michigan Hospitals in Ann Arbor, Michigan. Since 2017, she has been consulting in laboratory management. She holds a bachelor's degree from the University of Michigan and a master's degree in management and supervision from Central Michigan University. She is certified as a medical laboratory scientist, specialist in blood bank technology, and as a diplomat in laboratory management from ASCP, and is certified as quality auditor by the American Society for Quality. She has been active in the state, national, and international professional societies and edited books on irradiation and information technology in transfusion medicine. She currently serves chair of the ASCLS Leadership Academy, as an advisor to the ASCLS PACE Committee, and as trustee of the ASCLS Education and Research Fund. She serves on the AABB Public Policy Strategy Committee and as a member of the AABB Coding and Reimbursement Committee, and on the ISBT Working Party on Information Technology. So now I'd like to welcome Ms. Suzanne Butch.
Well, thank you. Today's topic, making the most of post-go live assessments. Oftentimes we're just so excited about going live that we forget how important this activity really is. Our objectives today are to define the purpose of this go live assessment, to outline items to be included in the assessment, and to define a process for making sure it's integrated into your processes and that you get the learning in future projects. So again, you went live, and certainly it is time to celebrate because it's been a grueling, in most cases grueling, even if it's a small thing, there's lots of planning going on. So you've gone live and a week or two passes and it's time to do a post assessment. Now the FDA recommended in its guidance for industry that it put out in 2013 was that you closely monitor the system for a period of time after the installation of a new or upgraded system to detect discrepancies that were not identified by test cases. So great. But we want to make sure that we document this process, because if we didn't write it down, we didn't do it. And we want to make sure that the learning is there just in case we're not there the next time. So why do it? It's of course process improvement. We want to improve the validation process, perhaps streamline it, and improve the implementation. We want to reduce the number of future post-go-live anomalies, and we want to make it more efficient, as I said, with the test cases. Now, in the general principles of software validation, the FDA talks about anomaly evaluation, and it suggests that mistakes are repeated because we fail to take the next step to determine the root cause of the problems and make the process and procedural changes needed to avoid the problems. Now, changes in software lead to defects, or as some people call them, undocumented features. The FDA, and granted this is old data, but my personal experience is that this is true today. They looked at 314 medical device recalls between 1992 and 1998, and there were 242 of them were attributable to software failures. And of those, 79% were caused by software defects introduced when changes were made to the software after its initial production and distribution. So there's a good chance that these defects happen later. So let's take a look at, in my experience, two cases. One was the validation was complete on a fix for a display issue. There were no problems found. Post-go live, however, the billing for pooled blood components failed. It was discovered when the monthly statistics for billing showed 0 components in that billed. So the recovery, of course, was arduous. We first had to correct the software billing, or the billing, and then we had to go back and look at who were the patients who were billed and try to recover some of the reimbursement by rebilling. The prevention, of course, was we were going to add a test and make sure we had a pooled component that was transfused and made sure that it billed. Our previous test cases had only used red cells and plasma and an unpooled platelet. And of course, we're going to monitor billing, not just waiting a month, but we're going to monitor billing on a daily basis after our next change. Another case was, again, the validation was complete. We didn't find any problems. And we were correcting the display of the patient's medical record for units presumed transfused. Post go live, several days later, it was noted that if you didn't put the leading 0 in when you entered the medical record number, if there needed to be a leading 0, no transfusions were displayed. The recovery was notify staff of the anomaly, and prevention was to a software fix. That might include not allowing you to enter it without the correct number of digits. So when we introduce new software post go live, what we want to do is make sure that we test for the major functions. But we also want to put in those things that were red flags in previous post go live assessments. So what functions are we concerned about? Well, we want to look at those that are the greatest risk. First to patient care, regulatory issues, and certainly financial issues are important, although our regulators don't care for it from the FDA. Certainly CMS wants to make sure that we are billing correctly. So the more risk there is, the more validation. And if the history with that software is that functions are broken when changes are made, we want to make sure we test those functions. We want to make better test case scenarios. Okay, oops. So what should we be looking for when we do post-implementation review? Well, we want to look at how is it functioning? What are the peak loads? What happens then? Are users satisfied? Is the response time too slow? Is there a delay if a certain process is running? Say a batch process is running in the background, does it really delay, and do we have to change things? What suggested changes do people have? And how much effort would be required to make those changes? Maintenance review, review completed and pending changes to the system. We want to review the conclusions regarding the benefits to be achieved if we did that, and conclusions about the amount of maintenance required based on activity that has occurred to date. And this came from the State of Maryland suggestions on software review. But don't forget what I consider operational issues when you review your post-go live. Were all the people communicated to in a timely manner? Did you get a whole bunch of, well, you know, I didn't know about this, but this was happening, or why is this happening? Another thing is all stakeholders should be notified that there's going to be an operational slowdown. The worst experience in my whole career was a 2-week period after we went live on our lab computer system. Now, we had successfully dealt with the hospital information changing its whole computer system 6 months previously. And that was not a problem for the transfusion service. However, they reduced the number of patients they were seeing. They didn't have as many people admitted to the hospital for a whole week after that conversion. We didn't even bother to tell the hospital administration that we thought there might be a slowdown. And needless to say, it was a problem. So making sure all people are notified and that we consider how long is it going to take to recover from this based on our previous experience. And then we have to think about the people. Do we have adequate staffing? We want to overstaff during these times. Do these people have access to food and water and during this whole experience? And is there adequate administrative support to be there to field questions from people, especially if things aren't going as well as hoped? So we want to consider people's general satisfaction with the system. What does the end user think? What are the strengths of the system? Included any problems? What are they having? Frequently used features. Are there features that they infrequently use or some features that they don't use at all? And some suggested improvements. Now, why would we want to do this? Well, we might think of turning off some features and not having to validate those in the future, for example. We should also make sure we have written procedures for all of the things that are listed here. For example, did we have a good training program? Do we have disaster recovery? Are all the procedure manuals for the end user still using the terminology from the previous vendor's computer? How is the program's data security? All of these things need to be considered in this report that we're writing and our policy. Now, this is somewhat controversial in the sense of nobody wants to revalidate unless they're doing an upgrade. But an evaluation of the computer software and its function needs to be done periodically. And this comes from the World Health Organization Guidelines on Validation. It is a draft from May 2016. I did not find an updated version of it. But what they suggest is you need to look at it periodically to determine whether the system is validated or not, and does it need revalidation. The scope and extent of the revalidation, again, should be using a risk base. So take a look at what are the riskiest things, including patient care and finances as well. The reviewer should at least cover a review of any changes, a review of deviations, incidents, certainly the amount of downtime and the incidents that occur, systems documentation, procedures, training, and effectiveness of the corrective and preventative action. Now you're probably sighing at this point and saying something, oh, this is going to take a great deal of time. Well, if we have a process for reporting all of these things, writing the summary won't be that difficult. Another really, really important thing is after we've gone live, it's not uncommon for support people who were there at the time of go live to leave. So there's some of the great resource people in how to use the system. Oftentimes, a year later, we don't have anybody except one person who knows about a certain segment of that software. So there needs to be a plan for maintaining system knowledge. Now, in our institution, when it comes to assessments, it says rather than say nobody can have vacation for 3 weeks because the AABB might come, or the CAP, or the Joint Commission, we have this idea of 3 deep. There are at least 3 people in each section who know enough to be there to handle an assessment if one happens while the other people are gone. And so we think about using that principle in saying there are 3 people who know how to make changes. A friend of mine was a person responsible for a computer system at a blood center, and we would be in Europe, and she would get email messages about things that needed to be changed. You don't want that kind of thing happening. And the important thing about this post-assessment is you're going to look at the information that you collected in your post-assessment, and you're going to say, before I start this new project, how is it that I need to change my plan to make sure that I overcome or include validation that will detect the problems that I've had in the past? So it's important to be that first step. So in summary, the purpose of a post-go-live assessment is to document what went well, what went wrong, and recommendations for monitoring and future validation projects. The items to be included in the assessment are, at least at a minimum, a review of changes, deviations, incidents, systems documentation, procedures, training, and our effectiveness of CAPA. We'll also want to include how it affects the operational issues for the institution. And we'll want to make sure that we have a process of integrating lessons learned into future projects by amending the current SOP for validation to review records of post-live events, creating an SOP for post-live assessment, and creating a recording method, for initial documentation and follow-up. So this short little session hopefully will give you some information on how to do a post-live assessment and integrate that assessment into your future validation plans. Thank you for listening.
Thank you, Suzanne. As you can see, the slides will be sent out to all attendees. And again, if you have any questions regarding the webinar, please don't hesitate to send them to the emails listed or the BCS Solutions website, or you could send them to info@bcssolutionsrfn.com. Thank you very much for attending, and have a great day.